Hi, everyone. My name's Allie, and I chose to do my presentation on Parkinson's disease. What is Parkinson's? It is an ongoing neurodegenerative disorder in which the cells in our brain are in charge of producing dopamine will either stop working or die. Dopamine is a neurotransmitter slash chemical responsible for sending messages between nerve cells, muscle cells to help their body function properly. This chemical plays a role not only physically but also mentally. This disease has the most significant impact on the substantia nigra. This area is located in the midbrain, posterior to the crus cerebri fibers of the cerebral pedicle. This region can be broken into two separate parts in which we have named the pars compacta, or SNPC, or the pars reticulata, which is SNPR. The SNPC is where your dopaminergic neurons are located, and that's what is impacted most heavily by this disease. So for genetics, it has been shown that only 10 to 15% of PD cases are caused by genetics, and the likelihood of someone developing PD from a relative is quite low. 90% of those suffering from PD have no known genetic links, and on the other hand, there's only about 10% who have a known genetic link, and it has been passed to other family members. Dozens of gene mutations have been shown to cause PD, and researchers are now studying the role that they play in Parkinson's. So right here is an autosomal dominant inheritance chart of kind of how Parkinson's can affect family members. So these are the most common mutations in genes associated with Parkinson's disease: GBA, LRRK2, PRKN, SNCA, PINK1, PARK7, and VPS35. So this is just kind of explaining a little bit of what each of these do, but these are the most common mutations that you will see in Parkinson's disease patients. So here's the progression of Parkinson's disease. As you can see, there are 5 stages. You kind of start off with tremors on one side of the body, mild clumsiness, a little bit of stiffness and posture. Stage 2 is when your bodily movement, the tremors, the rigidity, all of that, they start to affect both sides of the body rather than just one. And then walking, changing your clothes may start to take a little bit longer. Stage 3, you're going to find a loss of balance, slowed movement, and a little bit of difficulty doing everyday activities. Stage 4 is when your movement is becoming more limited and that the patient is going to require assistive devices such as a cane or a wheelchair. And then stage 5 is when they're going to need complete care, difficulty standing, they're bedridden, or it could be in a wheelchair. So stages 1 and 2 are considered the early stages, 2 and 3 are the mid stages, and 4 and 5 will be the more advanced stages. It is important to remember that not every patient will experience the same signs and symptoms as others. It is an individual base. This includes the order that symptoms may begin to develop and seem more noticeable, and also the intensity of these symptoms. Fluctuations with motor control tend to become an issue around the 5 to 10 year mark, while postural stability, such as balance or falling, happens closer to the 10+ year mark. So symptoms of Parkinson's disease, as you can see here, we have tremor, shaking, starting on the one side, rigidity, which is stiffness of the limbs, akinesia, which is a loss or impairment in the power of voluntary movement, and then posture and balance. And then on the right-hand side, you're going to see this is what people see. So it's going to be what's above that blue line. That's what is visible to the human eye. And then underneath is kind of what we don't see, what's under the surface, things that they might be dealing with internally, things that, we don't necessarily wouldn't make us think that they have some sort of disease going on. It is important to know that there are numerous types of symptoms that can be present in someone with PD. They can be visible and obvious, or they can be under the surface and harder to observe. The different types of symptoms include motor, non-motor, autonomic, mood, and thinking changes, and other physical changes as well. Since these symptoms occur on an individual basis, it is important to recognize and know your body so that you and your doctor can make a plan based on personal needs rather than a generalized plan that may not be as effective. The diagnosis of Parkinson's. When diagnosing PD, doctors will typically look for signs of tremor or shaking, bradykinesia, rigidity, and posture instability. They will also note any medical history and complete a physical examination. Your doctor will ask about any current medication being taken. This is important because some medications actually can cause symptoms that are very similar to the symptoms of Parkinson's disease. And then, you could be misdiagnosed. They will also do a neurological exam, agility testing, muscle tone, and gait and balance. As of 2011, the US Food and Drug Administration approved an image scanning we call DAT scan. This allows doctors to get an image of the brain's dopamine system using a small amount of radioactive drug, which will bind to the dopamine transmitters and show us where the dopaminergic neurons are located in the brain. This test will not tell us if the patient has Parkinson's, but it will allow us to rule out any mimics of it and get a better information on how the dopamine is responding that would cause Parkinson's. There is no specific test, unfortunately, to diagnose Parkinson's. This is why oftentimes patients are misdiagnosed and years later find out that they, in fact, do not have Parkinson's. The effect of Parkinson's disease on exercise response. So for those that are in the earlier stages of PD, it typically does not have any impact on their ability to exercise, just the same as anyone else their age that wouldn't have this disease. Once patients progress into the later stages of PD, they begin to feel the symptoms more intensely than before. And this includes seeing loss of joint stability and flexibility, which is going to have an impact on their balance during exercising, beginning to experience fast muscle loss, which will affect their strength, for example, walking and being able to move from a sitting position to a standing position easily or without assistance. And then you will also see a decrease in endurance, and this is due to a decrease in their cardiovascular fitness because a lot of times these patients will become sedentary. So for management and medications, managing PD can be difficult, especially if you don't have a good support system. So a few tips would be eating a balanced diet, having a good sleep routine, getting regular physical activity, even if it's not going to the gym, participating in stimulating activities such as doing a puzzle or anything that kind of keep your mind working. Finding a community where you feel welcome is also super important. The most common medications prescribed to a patient with PD are levodopa, dopamine agonists, MAOB inhibitors, and anticholinergics. So levodopa is a first-line drug, typically in pill form, given in combination with carbidopa to reduce and prevent the nausea from the levodopa. It comes in many forms from immediate release to time release. It can also come as an intestinal gel or an inhaler. The dopamine agonist, unlike levodopa, this drug mimics the effects of dopamine without having to be converted and is oftentimes prescribed to treat the motor symptoms from PD. MAOB inhibitors provide the most modest benefits for movement symptoms, often used in the disease and in conjunction with other medications. This drug naturally breaks down chemicals in the brain, making dopamine further available. And then anticholinergics first were used in the 1900s. It is the oldest class of medication used for Parkinson's disease and is known to decrease saliva production, so the drooling, and can also be helpful to younger patients that are experiencing more severe tremors. So for my case study, I decided that I was going to use a 56-year-old female, middle stage of Parkinson's disease, having difficulties with balance and walking long distances, having increased stiffness and decreased range of motion, experience a mild tremor with a loss of sense of coordination. Patient is a retired nurse and now is working part-time at an elementary school library. She does stay quite active throughout the day and tries not to sit for long periods of time. She lives with her husband and has no known children. They live in a one-story home, so she does not have to deal with many stairs. Her goal is to move around more comfortably and be able to walk without fear of falling. She's very motivated and ready to work with both a physical therapist and at home on her own time. So for exercise testing, I decided to choose the timed up and go test, otherwise known as the tug test. During this test, the patient will start sitting in an armchair, asked to rise and walk to a marker that is 3 meters away, walk back, and then sit back down. I believe this test would be beneficial for our patient in order for us to gather more information on how she is performing with lower extremity function, balance, mobility, and also to determine her fall risk. And then I also thought a forward functional reach test may be beneficial. This test helps us to determine the maximum distance our patient can reach forward past arm's length while also maintaining a fixed base of support. I think this test would help us gauge her reach capacity and where her fall risk begins. By doing this, we can help her get comfortable only reaching to her maximum and then asking for additional help so that we can eliminate some of that risk of falling. For her exercise prescription for aerobic activity, I decided that it would be beneficial for her to do 3 days a week moderate to vigorous intensity, at least 30 minutes per day. We want to try and reach a minimum of 150 minutes per week. This would include brisk walking, running, cycling, swimming, mostly what she feels comfortable with. For strength training, we want to do 2 to 3 non-consecutive days per week at a moderate intensity, 30 minutes per day, 10 to 12 reps of each exercise, 1 to 2 sets depending on her level or stage of Parkinson's disease. Type is going to be body weight exercises, resistance bands, free weights, and then we just want to make sure that we are covering the major muscles. And again, for Parkinson's disease, I decided to add in balance, agility, and multitasking because I feel that this is an important aspect of helping someone. Frequency would be a minimum of 2 to 3 days per week, but daily would be beneficial. Intensity would be moderate, time about 30 minutes per day. And then we want to do maybe some multi-directional stepping, sit to stand, yoga, weight shifting activities. We can also throw in, again, like I said, puzzles or any kind of mind game. And then for stretching, minimum of 2 to 3 days per week, daily would be most beneficial for her. Intensity would be stretching to a point of slight discomfort or tension. We want to do this about 10 to 15 minutes per session and also include static, dynamic, and PNF if appropriate. We may need to make adjustments based on how she's progressing through her stages. So from this presentation, I hope to spread awareness of Parkinson's disease and let people know that the science may not always be as obvious as we think, so listen to your friends and family. I chose this topic to learn more myself so that I can help my grandfather who has had Parkinson's disease my entire life. He is my best friend, and being able to research this was really cool for me, and I kind of understand a little more when I talk to him, and he feels that he's being heard, which is a really great thing. Parkinson's disease is oftentimes an overlooked disease since it has similar side effects of other common diseases as well as medications, and it also has no specific test to determine if you have this disease, which makes it a difficult diagnosis for everyone involved. And unfortunately, there is no cure for it. But I hope that you enjoyed my presentation on Parkinson's disease, and I hope that you have a great rest of your day. And here are my references.